So most people think sugar is only a weight problem, but sugar may be draining your energy before it ever shows up on the scale. So it can affect your cravings, your blood sugar, your mouth, and the way your cells produce energy. And here's the part most people miss. Sugar starts affecting your body before you even swallow it. This is not about fear or never eating sugar again. It's about understanding why frequent sugar exposure can make the body feel tired and inflamed and metabolically stuck. So, when most people talk about sugar, they usually talk about calories. They say sugar has calories and therefore calories cause weight gain. But that can be true, but it's also incomplete because the body is not just a calculator. The body is a living system. Sugar affects blood glucose. Sugar affects cravings. It affects energy crashes. Sugar affects oral bacteria. As an oral surgeon, this one hits home for me. And over time, frequent sugar exposure can affect metabolic health. And that's why someone may not only gain weight, they may feel tired after meals. They may crave more sugar. They may feel foggy in the afternoon. Their mouth may not feel healthy. Their gums may bleed, and their energy may never feel stable. So the deeper question is not only how many calories are in this, but the better question is, what is this doing to my biology all day long? So here is where the mouth-body connection becomes really important. Sugar does not wait until it reaches your stomach to affect your body. The first place sugar meets your body is in your mouth. Your mouth naturally has bacteria. There's an oral microbiome as well as a gut microbiome. And that bacteria in the mouth is normal. But when sugar and starches are constantly present, certain bacteria can use them as fuel. And they can produce acids that weaken enamel and disturb the oral environment. And that's why sugar frequency actually matters. It's not only about how much sugar you actually eat, it's also how often your mouth is exposed to it. So a dessert after a meal is a very different animal than sipping a sugary drink for 6 hours straight. One is a very short exposure, while the other keeps feeding oral environment again and again. And if the mouth becomes inflamed or unhealthy, that can become one more stress the body has to manage. So this doesn't mean that sugar instantly causes disease. It means frequent sugar exposure can create conditions that stress the mouth and the metabolism all at the same time. Now let's connect sugar to energy. When you eat or drink something sugary, your blood glucose can rise quickly, can spike. And at first, that may feel like quick energy, but then your body has to respond to that spike. And insulin's the main hormone that helps move the sugar from the blood into the cells. And when this system works well, blood sugar stays much more stable. But when glucose spikes happen again and again and again, especially with low movement, poor sleep, inflammation, the system then becomes less efficient over time. And that's why many people start to feel metabolically stuck. They may notice things like energy crashes after meals or strong sugar cravings, brain fog, sleepiness after eating, hunger soon after a meal, and a feeling that the body is not using the fuel properly or using it well or efficiently. Now, this doesn't mean that sugar alone explains every metabolic problem. That would really be far too simple. But frequent sugar intake can be an important driver in a bigger pattern. The point is not to blame the person. The point is to understand the pattern. So let's now bring in the mitochondria. Mitochondria are tiny little power stations or battery packs inside of each and every one of our cells. They help to turn food and oxygen into usable energy. But these power stations, they work best when the body has steady sources of fuel and a low stress internal environment. So frequent sugar spikes can create just the opposite effect. The body gets quick fuel, but then a big crash. Then cravings, then more sugar, then another crash. That's not stable energy. That is a metabolic turbulence. And if the pattern is happening alongside oral inflammation, poor sleep, low movement, or chronic stress, the body may be spending more energy trying to maintain the chaos than creating steady energy. So when we talk about sugar, we should not only talk about fat, we should talk about energy. We should talk about the mouth. We should talk about overall systemic or body inflammation. And we should talk about the system, because your cells, they don't really care about diet trends. They respond to the environment you create every single day. So here's what most people get wrong. And there are three big myths that we're going to talk about when in regards to sugar. First, sugar is only a weight issue. Well, sugar can contribute to weight gain, but that's not the whole story. It can also affect cravings, energy stability, oral health, blood sugar control, and inflammation. So the second myth is, if I'm not diabetic, sugar, it's not really a problem. Well, you don't have to be diabetic to feel energy crashes and cravings, brain fog, or blood sugar swings and mood swings. The body can show signs of metabolic stress before a major diagnosis occurs. And the third myth, this one's oral, is brushing's enough. Even if I eat sugar often, all I have to do is brush and that'll take care of it. Well, I'm here to tell you that brushing absolutely matters, and flossing matters, and dental care matters. But if the mouth is constantly exposed to sugar, the oral environment may still stay under repeated stresses. And oral health is not only about cleaning, it's also about what the mouth is exposed to all day long. So here are some practical signs to be paying attention to. You want to notice if sugar is connected with things like cravings after eating, or afternoon energy crashes, brain fog, sleepiness after meals, bad breath, bleeding gums, frequent cavities, or feeling like your energy levels depend on caffeine and sugar. Now, these signs, they don't diagnose you, but they are clues. And clues are useful because they show you where the pattern may be starting. The goal is not to fear sugar. The goal is to understand your body's response to sugar. So here's what I want you to do next. Here are 3 realistic steps that you can take right now. So first, you want to make sure to reduce sugar frequency. Don't only ask, how much sugar did I eat? Ask yourself, how often is sugar passing through my lips, into my mouth, and spiking my blood sugar? Second, build meals for stable energy. You want to focus on things like protein and fiber and real foods. This helps energy feel more stable than starting the day with sugar and caffeine and starting that roller coaster ride. Even a short walk after meals can also help your body use glucose more effectively. And then third, take oral signs seriously. Things like bleeding gums, frequent cavities, persistent bad breath, tooth pain, or infection, these things should not be ignored. If these signs continue, get evaluated by a dentist or a qualified professional. And if you have persistent fatigue, uncontrolled blood sugar, unexplained weight changes, pain, infection, or ongoing symptoms, speak with a qualified doctor or dentist, so a physician or a DDS or DD or DMD. And remember, this video is for education only and is not a replacement for personal medical or dental advice. Okay, so here is my main takeaway. Sugar does not just feed fat. It can feed cravings, it can feed energy crashes, it can feed oral imbalance, and it can feed metabolic stress. The goal is not guilt. The goal is awareness. And if you want better energy, better oral health, and better metabolic function, start by looking at your daily sugar pattern. Ask yourself things like, is my body getting steady fuel, or am I forcing it to survive on spikes and crashes? And if this helped you see sugar differently, comment below with the sugar pattern that you notice most in your own day. And make sure to subscribe for more root cause health conversations that connect the mouth, metabolism, inflammation, and cellular energy. So I want to thank you for your time, your attention, and make sure to stay tuned for the next video. I'll see you in that one. Bye-bye.